Reform webinar, part of our webinar series, Big Changes Affecting Applicable Large Employers in 2015. I'm Carl Kleiman. I manage our Healthcare Reform Initiative here at CoAdvantage, and we're glad to have you with us this morning. Before we get started, just a couple of housekeeping items. First of all, this morning's webinar will be muted based on the number of attendees. So to ask questions, you can simply type them into the control panel on the right-hand side of your screen and click send. We will try to save time at the end of today's webinar to address some questions, and in addition, all of those in attendance will receive a full transcript of all of the entire webinar, plus the Q&A from today's webinar, if you'll just simply take a couple of minutes to complete our survey afterwards. Also, I want to welcome Eric Foster. He is joining me for today's webinar. Eric is the Chief Operating Officer of Compass Consulting Group and is an economics major from William & Mary. He's also an expert on healthcare reform matters. If you've attended our other webinars, you've probably heard Eric speak. So welcome, Eric. I just want to run through some of the things that we'll cover today. So first of all, as you may know, we've targeted today's event toward what are called applicable large employers under the healthcare law, and we'll talk more about what an applicable large employer is, but this is the group of employers that are subject to new regulations starting January 1, 2015. And so the focus of today's webinar are for applicable large employers, primarily employers with 50 or more full-time equivalent employees. Some large employers are going to be subject to more regulation than others, and some sooner than others. So some questions that you should be asking yourself at this stage is, number one, is your organization an applicable large employer? If so, do you have between 50 and 99 full-time equivalent employees, or do you have 100 or more? This has to do with when the new law affects you and how it affects you. If you have 50 to 99, you should also be asking yourself whether or not you're entitled to any kind of transition relief. The relevance of that determines whether you have to comply with some of these new regulations in 2015 or in 2016. If you sponsor a fiscal year plan, are you entitled to fiscal year plan transition relief? The relevance of that question is whether or not you need to comply with some of these new rules on January the 1st or the beginning date of your fiscal year health plan. You should want to know whether you're exposed to player pay penalties in 2015, and if so, when and probably how much. Is your organization prepared to comply with the new reporting requirements? By the way, these go into effect for all applicable large employers starting January 1, whether you have 50 or whether you have 100 full-time equivalent employees. And you're probably also asking, what can CoAdvantage do to help? If you're a client of CoAdvantage and on today's call, you probably already have a pretty good idea of what those things are, but we'll cover those as well. So our formal agenda will address if, when, and how these new Affordable Care Act regulations will apply to your organization and what you must do in order to comply with those. So in the first section, we'll talk about applicable large employer status. Our hope is you come away from this webinar today with a pretty good idea of whether your organization is or isn't an applicable large employer. Then what is required of ALEs and when is it required? We'll talk about the employer mandate. That's one of the most substantial requirements of the new law. We'll talk about transition relief rules, again for small ALEs, those with 50 to 99 employees, and we'll talk more about fiscal year plan transition relief. We'll talk a little about the new IRS reporting requirements. We even have some images of the reporting forms themselves, and we'll close with a section on what CoAdvantage can do to help. So with that, I'd like to turn it over to Eric. He'll present part one. Eric.
Thanks, Carl. Good morning, everyone. So we're talking here about determining ALE status. And of course, ALE stands for Applicable Large Employer. And what is that under the Affordable Care Act? An ALE is an employer which employed on average at least 50 full-time equivalent employees, which we abbreviate as FTEs, across all control group entities in 2014, or any consecutive 6-month period in 2014. It's important to keep in mind, again, we've talked about this in prior webinars, but controlled groups are the basis for determining size, and that's commonly owned or controlled entities, and they must be combined for purposes of determining that status. You can see more about that at coadvantage.com/controlled group. Employers translate part-time, variable hour, and seasonal employees into full-time equivalents in the process of determining size under the ACA and ALE status. The applicable period is calendar year 2014 or any consecutive 6-month period. The reason for that is because if you had to wait for the entire calendar year of 2014, it might be too late for determining what your status is for 2015. So the law allows you to use any consecutive 6-month period for your test. For example, January through July could be used to determine your ALE status for 2015. An actual example of an FTE calculation is here with a hypothetical company called the Acme Corporation that has 60 employees. Using 2014 payroll data, or again any consecutive 6-month period in 2014, we determine the number of FTEs in each calendar month, including all of the controlled group entities. So as you can see in the box in the middle, step one is the full-time employee calculation. So we add the total number of full-time employees, those working 30 or more hours per week, or as an alternative 130 or more hours in the month. And we add all of those together. So in our example here, we have 30 actual full-time employees for our Acme Corporation. Step two then is determining the part-time equivalent, or the full-time equivalent value that is attributable to part-time employees. And there you sum all hours worked by the part-time employees, and those are those working less than 30 hours per week or 130 hours in the month. You cannot exceed giving credit for more than 120 hours per employee in the calculation, and then you divide by 120. That determines, again, the full-time equivalent of the part-time employees. So in our example here, even though there are actual 30 part-time employees, because of the hours they actually work, in our calculation they work out to 21.25 full-time equivalents. Keep in mind in this calculation that the actual status of whether an employee is full-time or part-time officially does not matter. Just the hours that they work in that month determines whether they're classified as full-time or part-time in your calculation. So once you have both the full-time and the part-time calculation completed, you add them together. And for this sample month, we have 51.25 full-time equivalents for our Acme Corporation. You would then repeat the exercise for each month that you're using in the 2014 calculation. Again, it could just be 6 months. And that would produce then the result for your classification for the next calendar year of 2015. Using 2014 payroll in this example, again, if we continue, step 4 would be adding together the FTE counts for all 12 months. In this case, we are using a 12-month example, not a 6-month example, so it's 615 in our example. So we did that calculation that I showed you on the prior slide 12 times, added all of those numbers together without rounding down, and that produced 615. And then we divide it into an average. In this case, in our example, it averaged 51.25. Then we round down. You round down at the end of adding together all of the months in your calculation, so it produces 51. And then in this case, step 6 would be determining if there are seasonal employees to take out, because in this case the result is more than 50. So this group would be an applicable large employer before considering seasonal employees. The step 6 here explains the fact that for seasonal employees, you may exclude all hours worked by them during a single 4-month period during the year. And in our example, we had 3 seasonal workers with 100 total hours from May through August, which allowed us to exclude the equivalent of 1 employee. So our revised total FTEs is 50 for Acme Corporation, and that means that Acme is still an applicable large employer for 2015. Control groups have to be included in the calculation, and the interesting thing for a PEO is that you may not have complete transparency on the control groups for each one of your clients. You probably don't. You may not provide services to all of the control groups, so you really need to ask the question of your employers as to whether those exist and whether they should be included. A control group is 2 or more entities that are related or affiliated as described below. Those entities need to be combined in the calculation. 3 broad examples or classifications of control groups are listed at the bottom here. You have a parent subsidiary, a brother sister, and an affiliated service group. The regulations on how to calculate these or determine if you are in fact a controlled group under one of these 3 criteria is pretty complex, and it's not something that a PEO is really in the best position to determine. We recommend that you advise your clients to talk with their counsel, talk with their tax experts to determine if in fact these apply to them. You can get more information once again by going to coadvantage.com/control group. We'll pause now for a survey question.
Okay, Eric, thanks. So, which do you believe best describes your organization after hearing Eric's presentation? Don't forget to include control group entities. So A, less than 50 FTEs, B, 50 to 99, C, 100 or more full-time equivalent employees. By the way, we have $25 gift cards that we'll give out today to 1 winner from the participants in our survey question. So, give you just a couple of seconds more to answer. Okay, so our polling results on the call, 9% with less than 50 FTEs, 64% have 50 to 99, and 27% have 100 or more FTEs. Very good. Thank you for participating.
Carl, do you see the beginning of section 2?
I do now.
Awesome.
Thank you, Eric. Okay, so for section 2, we're going to talk about new requirements for ALEs, for applicable large employers. So ALE status has slightly different meaning for different employers, at least in 2015, and that is to kind of help the smallest group, those with 50 to 99, kind of merge into the new rules and regulations for the most part. So first of all applicable large employers will be subject to new reporting requirements that start in January of 2015. We'll talk a little more about those reporting requirements later in the presentation. But suffice it to say, even if you have 50, 51, 52 FTEs, you'll be subject to those, and they're always based on a calendar year. So in January of 2016, you'll be providing reporting to employees and to the IRS for the entire year of 2015. Applicable large employers with 100 or more full-time equivalents will also be subject to the employer mandate. in 2015. So that means that they could be subject to pay or play penalties under the Affordable Care Act, and they may be eligible for fiscal year plan transition relief, which may postpone that from January 1 till the first day of their plan year in 2015. Now, what does the employer mandate mean for an ALE in 2015 with 100 or more employees? It simply means that the employer must offer minimum essential coverage that meets minimum value. In other words, covers at least 60% of the actuarially expected claims for a typical participant. And it must be affordable, meaning coverage must not cost the employee more than 9.5% of their Box 1 of the W-2 income. There are other safe harbors available to help meet that rule. And by the way, this coverage must be offered to at least 70% of all full-time employees. Full-time meaning those that work 30 hours or more on average. By the way, that threshold increases in 2016 from 70% to 95%. So again, for small ALEs, those with 50 to 99, likely not subject to the employer mandate in 2015. Those with 100 or more FTEs, very likely subject. The question is it January 1 or later in the year when the plan starts? And we'll cover that in a later slide. So let's talk about ALEs with 50 to 99 full-time equivalents. So most small employers will qualify for transition relief, giving them until 2016 to have to comply with the employer mandate. Another way to say what I've covered on these last couple of slides is this. The law says the employer mandate is imposed starting January 1, 2015. Another provision of the law says that employers can qualify for two kinds of transition relief. The first kind of transition relief is for small ALEs, those with 50 to 99 employees. That transition relief, if you qualify for it, so if you meet the size requirement, and there are a couple of other criteria that you have to meet, that you have an extra year. You have until 2016 to have to comply with the employer mandate. So that's threshold number one. We also talked about fiscal plan year transition relief, and what that dictates is whether you have to comply January 1 or the renewal date of your plan year in either 2015 or 2016, depending on your size. Okay? So in 2016, now as we get past 2015, in 2016, the stakes go up for all ALEs. So remember, in 2015, all ALEs were subject to the new reporting requirements. The employer mandate primarily applied to employers with 100 or more FTEs, and 70% was the coverage threshold to meet the employer mandate. Now we fast forward to 2016. Now all ALEs with 50 or more FTEs are subject to the employer mandate. So that threshold came down to catch the smaller group of employers, and the threshold for offering coverage went from 70% to 95% of full-time employees, meaning to avoid paying a $2,000 per employee penalty. In 2016, employers, ALEs, must offer coverage to at least 95% of their full-time employees. Remember, that coverage must meet MEC, minimum value, and affordability standards. Just as in 2015, in 2016, fiscal year plan transition relief is available for the small ALEs, those with 50 to 99, meaning the employer mandate may kick in on January 1, or it may kick in on the first day of the plan year in 2016, just depending on whether you have a fiscal year plan and whether you meet the requirements for that fiscal year plan transition relief. So in closing in this section, let me just say that there are only 4 dates that you really need to think about. Your subjectivity to the employer mandate is either going to occur on January 1 or the anniversary date of your plan renewal in 2015 if you have 100 or more FTEs. If you have 50 to 99 FTEs, it's either going to occur on January 1 of 16 or the first day of your plan year in 2016. So those are the 4 trigger dates, if you will, assuming that your company does qualify for any transition relief that you're entitled to. So Eric, with that, I'll turn it back to you for Section 3.
Thanks, Carl. In Section 3, we're going to talk about the employer mandate. Specifically, what are the employer shared responsibility requirements in 2015? Well, applicable large employers with 100 or more FTEs specifically are required to offer minimum essential coverage, which is the MEC we've talked about, that is both affordable and meets minimum value, which we abbreviate as MV, to at least 70% of their full-time employees, again beginning in 2015, or face pay or play penalties. Minimum essential coverage we talked about is offering a qualifying plan to at least 70% of full-time employees. Minimum essential coverage is very broadly defined. Anything that's offered by a licensed insurer that's a full coverage plan is going to meet minimum essential coverage. Examples of plans that wouldn't would be fixed indemnity plans that give somebody cash instead of actually giving them, reimbursing them or reimbursing the providers for providing medical care. That's an example of something that doesn't meet MEC, but most things in the marketplace purchased through licensed insurers will be MEC. Minimum actuarial value is the value of the plan, how much of the expected medical services are covered under the plan. It has to be 60%. And affordability requires that the employee-only coverage in the lowest cost plan not be more than 9.5% of the household income of the employee. And as we know, that you can use the W-2 income as an alternative to that. How can employers be expected to meet affordability requirements that are based on household income? Again, because you probably don't have, as an employer probably doesn't have a clear line of sight on the entire gross income for employees. They can use alternatives. An employer's coverage will be deemed affordable as long as the employee's contribution for employee-only coverage doesn't exceed one of those 3 alternatives at the bottom of the slide, the first one being the W-2 safe harbor. That's the one that we're probably most familiar with. It's 9.5% of the box 1 income on the employee's W-2. An alternative to that is the rate of pay safe harbor, which is 9.5% of the employer's lowest rate of pay to any employee. If an employer meets that, they certainly would meet it for anybody if they're benchmarking against the lowest paid employee. As an alternative to that, the federal poverty level can be used, and if someone sets 9.5% of the federal poverty level as the most that anybody would pay, then they would meet the affordability criterion that way. How will play or pay be calculated in 2015? There are 2 types of penalties. There's what we refer to as the A penalty and the B penalty. The section of the Internal Revenue Code that refers to these are defined under 4980H sections A and B. And ALEs that fail to offer MEC under the A penalty would be penalized at least at $2,000 annually for each full-time employee. And again, the test for offering the MEC is to 70% in 2015. That climbs to 95% in 2016 as the percentage of full-time employees that have to be offered coverage. in order to be penalized either under the A or the B, at least one employee needs to receive a subsidy. For the A, if any one employee receives a subsidy, then the entire penalty is enacted. So the A penalty is when you fail to offer coverage. That's the high-level view of it, using either the 70% or the 95% definition. The penalty for that, again, is $2,000 annually for each full-time employee minus the first 30 for 2016, 80 for 2015. This sounds confusing, but the reality is, again, because it's only ALEs with 100 or more full-time equivalents that have penalty exposure for 2015, it's that subset of ALEs, the calculation gets to exclude the first 80 full-time employees under the A penalty. The alternative penalty to the right on this is the B penalty. That is, if you do offer the MEC to at least 70% in 2015 or 95% in 2016, but you don't meet the either minimum value or affordability rules in the offering. In that case, if at least one employee receives a subsidy, there would be a penalty, but only for that employee. That's the big distinguishing thing between B penalties and A penalties. Only those that receive the penalties or subsidies under penalty B actually creates a penalty then for the employer. The penalty at the bottom here is assessed at a rate of $250 per month, $3,000 annually for each full-time employee that receives a subsidy. Here's an example again with our Acme employer. In this case, they have 101 full-time employees because this is a calculation for 2015, so we know they're an applicable employer that would be subject to penalties based on the fact that they have 101. They do offer coverage to 70% of the full-time employees as required, and 5 full-time employees were not offered coverage and received subsidized coverage through the exchange. Now, you could meet the 70% offering rule and not be exposed to the A penalty, but that still could mean up to 30% of your full-time employees still don't have access to coverage. And if any of those go out and receive subsidies, those then would create the B penalty for this type of applicable large employer. So what we see for the Acme Corporation is that the penalty would actually be to the right. It's the $3,000 per year for each full-time employee who receives a subsidy. The penalty on that basis is $15,000. It's the $3,000 annual penalty times the 5 to which it applies, or $15,000. Now, there is a test here. Every time we calculate a B penalty, we have to ensure that it does not exceed what the penalty would be under the A category, which is the penalty for not offering coverage. In this case, the maximum penalty that the employer would incur is $42,000 under the A penalty, and therefore the full $15,000 B penalty would apply. And with that, Carl, I will turn it over to you for part 4 on transition relief rules.
Okay, thanks, Eric. So maybe just a word on the government's logic there. Again, the A penalty is really intended to be the worst case scenario. So it's for employers that don't offer coverage at all or don't offer minimum essential coverage. So the B penalty is never intended to put you in a worse position than if you just hadn't offered coverage at all, if that logic makes sense. So now we'll talk a little bit about transition relief rules. First of all, I just want to admit that this whole concept of transition relief is a bit complicated. I get that. So I want to describe it really in 2 general categories. So first of all, there is size relief. So when we talk about transition relief, what we're really referring to are specific rules within the Affordable Care Act that help kind of graduate employers into this new regulatory scheme. So when we talk about transition relief, these are usually provisions that only have a limited time span or a limited impact on certain employers that qualify. So size relief was put out there under the recognition that the smallest employers The smallest ALEs, by the way, those with 50 to 99 FTEs, may have the most difficult time complying with these new rules. And so the intent was to give them an extra year, if you will. So if you'll recall, the employer mandate was set to go into effect in 2014, the same year that the employee mandate actually went into effect. All employers got a one-year reprieve to 2015. So if you're an ALE with 50 to 99 employees and you qualify for this transition relief, you've really gotten a 2-year reprieve from the original intent of the law. And again, just in case you're wondering, for those 7% of you that fall under that threshold, the employer mandate doesn't apply to you at all. And that doesn't mean healthcare reform doesn't affect you at all. It certainly does. It still creates requirements around the way plans are designed, what's covered, what's not covered. It gives you options to purchase coverage in the Small Business Health Options Program, the Small Business Tax Credits, a lot of other things that are outside of the scope of today's webinar. So the size relief only applies in 2015 and only applies to those with 50 to 99 employees. I should point out that it's not guaranteed, so you do have to earn that. An example would be for someone with 50 to 99 employees who cancels their plan, let's say, in 2015 because they're not subject to the employer mandate. They've just blown their transition relief. So the government's gone to great lengths to make sure that employers that are already offering coverage do not cease doing so. So these penalties for small ALEs can be postponed until either January 1 of 2016 or the first day of the employer's fiscal year plan in 16. So let's say if your plan renews October 1, if you're a client of CoAdvantage and you've been on our plan since this rule went into effect, which was December 27th of 2012, then the effective date of the employer mandate for you would be October 1, 2016. Fiscal plan year relief, again, applies to all ALEs regardless of 50 or more FTEs. Again, as I mentioned, based on having a fiscal year plan as opposed to a calendar year plan. And again, I want to repeat this trigger date. So if you've changed your plan renewal date to a later date in the year after December 27th of 12, then that transition fiscal year plan transition relief is no longer available. So what the government didn't want to happen upon the announcement of these rules is for everybody to rush out and change their plan renewal date to later in the year. So those are the two kinds of transition relief available to ALEs. So how do applicable large employers with 50 to 99 employees qualify for transition relief to delay the employer mandate until 2016? So again, as I've mentioned, it's not automatic. There are things that small ALEs can do that will blow their transition relief. A couple of others would be that the maintenance of your workforce and hours of service, meaning what the government did not want to happen is for, let's say, an employer with 102 employees to go out and terminate 3 employees or reduce the hours of a bunch of part-time employees to lower their full-time equivalent count. And so they put a rule in place that says unless for bona fide business reasons that you can prove, you can't reduce the number of employees or the hours after the announcement of these rules, and that trigger date is February 9th, 2014. So those reductions cannot occur during that time period between then and December 31st of 14. Second, if you have health coverage, you have to maintain that health coverage. So again, during the period February 9th of 14 through December 31st of 15, or for employers with fiscal year plans, the last day of your 2015 plan year, which could be well into 2016, you may not eliminate or materially reduce the health coverage that you offered when this was announced on February 9th. So again, the goal is that they want to prevent employers from saying, aha, we have a 1-year reprieve, we're just going to abandon the health care coverage, or we're going to water down, if you will, the coverage that we have. They've put rules into place to disincent employers from doing so. So fiscal year transition relief, how do applicable large employers qualify for this? Again, both small ALEs, 50 to 99, and large ALEs, 100 and up, are eligible for this fiscal year plan relief. So if I have 100 or more employees, this fiscal year relief potentially buys me from January 1 of 15 until the start of my plan year in 15. If I'm a small ALE, it buys me from January 1 of 16 until the start of my plan year in 2016. So again, for CoAdvantage clients, that's a 9-month span. So as long as you meet these rules, you are likely eligible to, for, in my example, that 9 months of additional relief. So the first thing, as I mentioned earlier, you have to have had that plan renewal date on December 27th of 2012. And after that date, you cannot have moved your plan renewal date to later in the year. You must offer MEC to at least 70% of your full-time employees on the first day of the 2015 plan year, and 95% in 2016. So what the law says here, if you don't intend to comply with the rules when they do go into effect, you don't get to take advantage of the additional time or the relief before the rules apply. If you're not going to comply, then you don't get the additional time. And finally, kind of the more complicated of these are you must meet one of the following conditions around your existing coverage. You either have to have offered coverage to all employees, meaning you either have to have offered coverage to at least 1/3 of all employees, including part-timers, by the way, or covered at least 1/4 of your full-time employees, or all of your employees, I should say. Or transition relief number 2, you must have offered coverage to at least half or covered at least 1/3. So in the first example, we're applying these calculations to all employees, regardless of whether they're full-time or part-time. In the second transition rule, we're applying these calculations only to full-time employees. So on the next slide, so obviously, if you have a carve-out plan, let's say that today you're only covering a very small percentage of your workforce, there is a chance that you won't qualify for the fiscal year plan transition relief. So maybe another way to say what I've said on the last couple of slides, because I recognize these concepts are a bit tedious and complex. So the size relief can be lost if you reduce your workforce below 100 FTEs specifically to qualify for the size-based transition relief. You have to have a bona fide business reason for either reducing staff or reducing the hours that your staff works. Secondly, you could reduce the coverage offered to the employees as of 2/9. So in other words, you go and you buy a much lesser plan, let's say one that doesn't meet minimum value, then you've blown your size-based transition relief. The ways to kind of lose the fiscal year plan transition relief would be if you didn't maintain the plan as of 12/27 of 12, or if you moved your renewal date to later in the year after that 12/27/12 date, or as of 2/9 of 14, you did not meet one of the transition relief rules that I covered on the last slide, meaning you either didn't didn't offer coverage to a large enough percentage of all employees, or offer coverage or cover a large enough percentage of full-time employees. I recognize that's a lot to grasp. It's one of the things we're very busy helping our clients kind of one by one understand where they fall through our ACA consults. So here's an actual illustration. This is Acme Corporation, which has 50 full-time employees and 10 part-time employees. Sponsors a fiscal year plan. That plan renews on July 1st of each year. So in Acme's case, they only offer coverage to their 20 salaried employees. So out of their total 60 employees, 50 full-time, only 20 get coverage. 15 of those 20 actually enrolled in coverage. So the question is, does Acme qualify for transition relief until the first day of its 2016 plan year? Now we know it's 2016 because this is a company with 50 to 99 employees. If they had 100 or more FTEs, we would be talking about 2015. So rule number one, they do meet the qualification in that they cover a high enough percentage of all employees. So Acme offered coverage to a third of the 60 total employees. They covered a fourth of those employees, and if you'll remember right, that 1/4 was the threshold, so they actually meet that rule. They fail the rule on coverage of full-time employees, so they did not offer coverage to at least half of the 50 full-timers, nor did they cover at least a third of the 50 full-timers, and so they failed that one. The good news is you only have to pass one or the other. So as long as they didn't eliminate or materially reduce the health coverage that they offered to employees there in the last section, they'll be fine. They'll qualify and won't have to contend with pay or play penalties until July 1 of 2016 instead of January 1 of 2016. So that brings us to our next survey question. Before we do that, I would like to announce that Sheila Schneider is the winner of our first drawing. Sheila, you'll receive a $25 Amex gift card for participating in the last survey, so thank you for that. So our next survey question, if your organization has 50 or more employees, when will you be subject to the employer shared responsibility rules? And as I've said earlier, there are 4 possible answers to this question, as you see, A, B, C, and D. We'll give you just a moment to answer. Okay, so our survey responses, January 1 of 15, 17% of you. January 1 of 2016, 0. First plan renewal date in 15, we have 33%. And the fiscal plan renewal date in 2016, 50%. So the good news is half of you don't have to comply with the employer mandate until kind of the latest possible option, which is your plan renewal date in 2016. So good news there.
And so I'll pick up on part 5 then, Carl.
Great.
This is regarding the new IRS 6056 reporting requirements. What are they? Well, they apply to all ALEs for 2015. So whether you have 50 to 99 FTEs or you have 100 or more, all ALEs will have to comply with the 6056 reporting requirements. It refers to the section of the Internal Revenue Code, 6056. The IRS has primary responsibility for monitoring employer compliance with the employer mandate. The forms that have been created to support Section 6056, as you see here in the middle of the slide, are Forms 1094C and 1095C. 1094C is the employer to the Internal Revenue Service transmittal. That's due as of February 28th, 2016. So employers have 2 months into 2016 to report to the IRS the activity of 2015. The employee statement is the one that is supported through 1095-C, and that employee statement goes from employers to their employees. That's due earlier. That's actually due by January 31st of 2016, so you only have 1 month. So what that means is that employers have 1 month to tell their employees the type of coverage they had for 2015. There are then 2 months to go on and transmit the information onto the Internal Revenue Service. It's the same information, just being transmitted through different forms. One, again, is intended for the employees to use so that when they file their taxes, they can show evidence of the coverage that they were offered and the coverage they had. And then the other, the 1094, is designed for employers to report to the Internal Revenue Service. The reporting is on a calendar year basis regardless of the plan year, so it's a tax year reporting requirement, not a plan year reporting requirement. Here's a sample on this slide of what the Form 1095-C looks like. This is what the employer would provide to the employees. This is the one that's due by the end of January. And you can see here in Part 1 that a specific employee is listed. Over to the right is the applicable large employer member, the employer information. And then in Section 2 you can see is where the employer would document the offering of the coverage. There are codes that go along with this to designate the type of coverage that was offered and under Section 4980H, which we talked about before, as well as the individuals that were covered by that coverage. There are instructions yet to be released on how to complete these forms. Obviously, we can show you a copy of what the form looks like because that's been released, but the instructions are still pending. But again, these don't need to be filed then until the beginning of 2016. This is the 1094-C form. This is what the employer then uses to transmit information to the Internal Revenue Service. This is a different format. You can see at the top then, this is just the applicable large employer information, and then below is the information summarized of what the employer provided in each month during the year, as well as some additional codes that would go on here. Again, information on completing these will be forthcoming. We're not certain of when it will be released, but we still do need to have instructions released. So now let's pause for our next survey question.
Okay. The winner from our last survey question was Maria Tobias. So Maria, congratulations. Next question. So you already have a process in place to do you already have a process in place to capture the information required for the new 6056 reporting requirements that start January 1? Just a simple yes or no answer. Okay, the results, 45% said yes, 55% said no. I will tell you that those reporting no are in pretty good company. The fact is that these draft regulations have been slow to come out of the IRS, and so don't feel alone. So we are busy building the technology to complete those forms. I'll cover that here just a little bit more in this last section, Section 6, which is what can CoAdvantage do to help. So quite a bit. I'm going to break this down this way. So first of all, for our clients, we are encouraging each, and we've conducted many already, but encouraging them to schedule a one-on-one consultation with one of our healthcare reform experts. We have a phone number here on the slide. We also have a dedicated email address, mailbox, aca@coadvantage.com. What we do during these consultations is we come to those discussions. They're typically by conference call. We come to those with a lot of labor analytics that help kind of identify the employee classifications to make sure those are accurate. So full-time, part-time, variable hour, seasonal, because those affect the accuracy of the reporting, and they also affect the FTE calculations. We also verify that hours are being reported for all employees, and so prior to the Affordable Care Act, it was fairly common for folks that are paid commission or piecework, or in some cases even salaried employees, where we weren't recording, or you weren't reporting hours because they weren't as material as they are today. So today you really need hours for all employees. That is the path to accurate full-time equivalency calculations. Will help make sure that you understand your full-time equivalence status, and therefore whether or not you qualify as a small applicable large employer, a large applicable large employer, or someone with fewer than 50 employees and not subject to the employer mandate at all. So for applicable large employers that participate in CoAdvantage provided employee benefit plans, we can obviously provide a higher level of service there. So we do have clients that have benefit plans other than those that we provide or sponsor or administer. Obviously, there's information that we don't have in those situations. We can offer a fair amount of assistance, but we can't offer as much. So let's talk first about what we can do for our clients that participate in our plans or in plans that we administer. We can help determine your eligibility for transition relief. That includes both the size-based relief and the fiscal year plan based relief, because we have the information needed to do that. If required, we can then verify that you meet the 70% offer of coverage threshold, because we know who's been offered coverage, we know who is participating in coverage, and so we have the data required to assist you with that. We can confirm that the medical plan meets the MEC, the minimum value, and the affordability requirements. By the way, something I want to point out is that the MEC and the minimum value determination is at the plan level. So the plan or plans you offer either meet MEC and minimum value or they don't. The affordability requirement is an employee by employee calculation. So for some of your employees, coverage may be affordable, for others it may not. And so that one is much more involved. I can tell you, if you are acquiring your employee benefits through CoAdvantage, your coverage meets MEC and it meets minimum value. And so the work we have left to do is to help you determine that it's affordable for even your lowest paid employees. We can ensure that we're collecting all of the information required to comply with the 6056 reporting requirements. An example would be control group information is required on these forms. So if your company is part of a controlled group of companies, let's say if you own multiple entities, let's say you own 3 companies, you'd actually have to file 3 1094Cs, which is the applicable form, and each one of those would have to reference the name and federal ID number of the other 2 related entities. And so there's new information that we'll have to collect and maintain in our systems in order to help you comply with these reporting requirements. So again, I would encourage you, if you haven't already, schedule an ACA consult if you're a CoAdvantage client. Again, some of these regulations go into effect as early as January 1, depending on whether you qualify for transition relief. So determining your status as an ALE and meeting your obligations under the employer mandate, as I mentioned before, alluded to, those are dependent on accurate data. So part of what we're doing in this consult process is making sure that we have or at least start to collect the information necessary to help you comply with these things. To determine employees' benefits eligibility, to make sure you're meeting the required 70% offer threshold, making sure that hours worked, including PTO hours, are tracked for all employees regardless of whether they're paid commissions or salaried or piecework. All of that is much more important going forward than it has been in the past because of the ACA. So we're working hard to assist our clients with those requirements. This was just a quick slide to point out the different employee classifications that we commonly see. So again, full-time employees under the law, that means an employee that works 30 or more hours a week or 130 or more hours each month. Part-time employees are those that fall under that threshold. Seasonal employees, any employee hired to work 120 days or fewer during the calendar year, and fill in for seasonal peaks in employment needs. And then variable hour employees, these are employees where the facts and circumstances of their hire makes their hours of service variable or otherwise uncertain. Independent contractors are not part of the FTE calculation. They're not employees and therefore not FTEs. My advice to you there would be to just make certain that they are indeed bona fide independent contractors. There are a whole separate set of rules that are relevant to determining independent contractor status. So one other service that we are providing for our clients that obtain their health care coverage through CoAdvantage is preparing the 6056 reports. By the way, when you hear the term 1094C and 1095C, those are the two forms that are described in that IRS code section. So the 1094C is the employer summary. For those of you familiar with payroll processing, that would be the equivalent of a W-3 summary. That is kind of the summary page for all of the individual W-2s. The 1095C are the employee statements that have to be provided to all employees that are participating in your plan by the last day of January, or actually the first day of February in 2016. It looks much like a W-2, and as you saw earlier when Eric went through the specimen of the form, contains a fair amount of information to help that employee complete their tax return and understand if they are subject to an individual mandate penalty as well. So with that, again, we welcome any questions. We only have a couple of minutes left, but if you have any questions that you would like to pose, feel free to submit them there and click the send button. We have one, Eric. I'll pose this question to you that's come in, and it is, how did you do the calculation for seasonal employees? Or in other words, how does the calculation for seasonal employees work? If you think back to our illustration earlier where we had 3 seasonal employees that came out of that calculation. Can you elaborate on that?
Yeah, so that specifically was an example where the group was an applicable large employer. It was a borderline, just barely over 50 FTEs. And so in that case, the employer can go back and recalculate it without seasonal employees included. So what we didn't show you is the actual step, Carl, of going back and showing each month without the seasonal employees included and then re-averaging. So we just summarized it at the end. So that was a good question. It's actually done each month. You just recalculate without the seasonal employees included and then show the calculation that way.
Got it. Got it. Next question is, I have fewer than 50 FTEs. Is there any chance or any duty that I have for the 6056 reporting requirements, or is this only for 50 and above?
It's only for the applicable large employers, those that have to show evidence of offering coverage. So if you're comfortable that on a controlled group basis, as an employer, you are less than 50 FTEs, then you don't need to worry about the 60-56.
Very good, and that brings us to the top of the hour. Before we end, first of all, I want to announce our third gift card winner. It's Janet Lugo. So Janet, congratulations! You won a $25 American Express gift card. Thanks for participating. And then if we can just advance. I would also like to invite you to next month's webinar, which will occur on January the 15th. We will cover measurement, administrative, and stability periods. This is a concept for those that have variable hour employees that don't work kind of consistent work schedules. This is a method prescribed under the law for determining eligibility for benefits. So that will be our topic for January 15th, 10 o'clock Central, 11 o'clock Eastern. We hope you can join us for that. And finally, I would welcome you to visit our healthcare reform page at coadvantage.com/HCR. There you will find a lot of information, including some of our prior webinars that have been recorded. You can reference those. This one will be posted out there in a matter of days. With that, I'd like to thank you for attending. We hope that you'll join us again soon. Eric, thank you for your help. I hope everyone has a wonderful day and happy holidays from CoAdvantage. Thanks.
Thank you.